Before we begin, our most blessed and best wishes to everyone during this Eid holiday. A lot of exciting developments to cover in this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. As usual, we will be discussing a wide range of innovative and important developments these past 7 days in the Middle East region. This week we will talk about the latest real-world information and insights on healthcare, life sciences, and wellness in the Middle East. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to June 5, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform HealthConnect Middle East. The week of May 29 to June 5 saw a mix of health sector initiatives and challenges across the Middle East. Key themes included government action on preventive health, notably around the upcoming Hajj pilgrimage, efforts to strengthen primary care systems, growing emphasis on age-friendly hospitals and rare disease care, and a continuing humanitarian public health crisis in Gaza. Several countries highlighted new partnerships and strategies in line with Vision 2030, while awareness campaigns underscored issues like mental health and tobacco use. At the same time, conflict and displacement in the region intensified public health emergencies, for example hospital closures in Gaza, that threaten progress in population health. This report summarizes the latest developments by country and sector, drawing our very reliable sources mentioned previously and always used. First, let's talk about healthcare policy and government initiatives. In Saudi Arabia, the Ministry of Health announced on May 29 the outcomes of Moja, a 2-day national event on inherited blood disorders. Moja, Arabic for inheritance, brought together local and international experts to review best practices in diagnosis and management of genetic hematology conditions. Officials said the initiative, part of Vision 2030's health sector transformation, will continue with targeted research and awareness. Notably, Saudi authorities designated April 19 as World Hemophilia Day to spotlight chronic bleeding disorders and strengthen early detection and treatment efforts. The ministry is encouraging clinicians and patient groups to use the Moja recommendations in future programs. In Lebanon, the government joined partners in scaling up primary care. On May 29, UNICEF and the EU reported that Lebanon's Ministry of Public Health held the annual review of Salame, meaning safety, a newly launched primary health initiative. Salame takes a life cycle approach to care from pregnancy through adolescence. In its first year, the program has already reached thousands of women and children. Over 25,000 children received timely vaccinations, 1,400 pregnant women got antenatal care, and about 15,900 newborns were followed up after birth. Some 114,000 household visits were conducted for child health and nutrition screening. Health Minister Rakan Nassereddine stressed that Salame represents a systemic shift to person-centered care, closing immunization gaps and improving maternal-infant health amid Lebanon's strained public system. This initiative reflects broader policy goals of reinforcing Lebanon's public health infrastructure through international collaboration and community outreach. In the United Arab Emirates, government warnings ahead of Hajj underscored the role of public health planning for mass events. On May 29, the UAE Ministry of Health and Prevention, MOHAP, issued a formal advisory for Emirati pilgrims traveling to Hajj, citing extreme summer heat as a serious health risk. The ministry urged pilgrims to limit sun exposure, use umbrellas and sunscreen, and stay well hydrated, drinking ample water and juices, to prevent heat stroke and exhaustion. Officials also stressed the importance of rest and easy pacing during outdoor rituals. Such seasonal health guidance is part of UAE efforts to coordinate with Saudi authorities on pilgrim safety. Earlier in May, Saudi Arabia similarly introduced a multilingual health kit for Hajj workers and pilgrims, although that announcement fell outside this week's reporting period. Other national initiatives included efforts to expand health coverage and streamline care. For example, in Kuwait in mid-May, just prior to our review timeframe, the health ministry began updating drug pricing and coverage, while Bahrain's health authorities participated in regional ministerial councils on pharmaceuticals. Though not specific to this week, such developments signal a continued government focus on affordability and access. Across the Gulf, ministries are also preparing for the summer peak season by boosting emergency services and public awareness, for example, deploying air ambulances and cloud seeding for cooler conditions, as reported in late May. These policies reflect a shared regional priority to modernize health systems under national development plans and Vision 2030 health sector strategies. On to the next area to discuss, which is life sciences and research innovation. Regional research institutions and health science organizations continue to pursue collaborations, though few high-profile announcements fell exactly in this week's time frame. Notable ongoing efforts include partnerships between medical centers and international experts on rare diseases and genetics. For instance, Qatar's Sidra Medicine and London's Great Ormond Street Hospital finalized a long-term collaboration in mid-May to advance pediatric gene therapies, reflecting the kind of innovation linkages underway in the region. In Saudi Arabia, the Moja conference itself involved discussions of emerging diagnostic technologies and inherited disorders, illustrating government interest in research innovation. Similarly, in Lebanon, the AA Salome program is informed by global best practices in vaccination and maternal care, drawing on WHO, UNICEF technical support. While specific new laboratory or biotech breakthroughs were not reported this week, these initiatives underscore an emphasis on integrating clinical research into policy. Technology transfer and education programs, for example, combine knowledge bridges between local universities and foreign institutions, are increasingly part of Middle Eastern health strategy, although detailed announcements in late May were limited. Next, we have the area of discussion focusing on biotech and pharmaceutical developments. The Middle East's biotech and pharma sectors remain in build-out mode, with governments encouraging local production and regulatory reforms. This week's news highlights were more policy-oriented than company-specific. For example, Iran's government has continued to invest in domestic pharmaceutical manufacturing, as it has for several years, and discussions have continued regarding cooperative vaccine production, notably for COVID-19 booster vaccines and future mRNA platforms. In Egypt and Iraq, health authorities worked on procurement agreements to assure steady drug supplies, though detailed contracts were not reported in this narrow time frame. Saudi Arabia is also progressing on plans to host global biotech conferences and incubators as part of its Vision 2030, but those events mostly take place later in the year. In the absence of major new product launches, the trend remains towards capacity building, expanding pharmaceutical industrial parks, training biotech entrepreneurs, and attracting partnerships with multinational firms. Regulatory news in late May included incremental steps. The UAE's health authorities continued updating lists of approved drugs and pricing regimes to improve access. For example, although not in this week's news, Kuwait's Ministry of Health announced mid-May that it would set new prices for dozens of critical medicines in line with a national pharmaceutical strategy. Across the region, health ministries and the WHO are monitoring the introduction of new generic and innovative products, from novel cancer therapies to advanced biologics, to enhance domestic treatment options. However, specific vaccine or drug approvals in this week were limited. Overall, the biopharma focus remains on establishing the infrastructure and incentives for a future biotechnology industry, a process reflected in recent weeks by government announcements, such as Saudi Arabia's Biotech Accelerator program, that are just now beginning to yield tangible deals and R&D projects. A challenging area is up next to discuss: public health challenges and disease outbreaks. A severe humanitarian and public health crisis continued to unfold in Gaza. On May 29, Al Jazeera reported an ordered closure of Al-Orda Hospital, the last functioning hospital in northern Gaza, forcing dozens of patients and staff to evacuate. The Gaza Health Ministry condemned the move as a crime and pleaded for protection of medical facilities. WHO reported that about 97 people, including 13 patients, remained inside Al-Orda at the time of closure and was arranging an emergency evacuation mission. With Al-Orda shut down, Gaza had essentially no operational hospitals in the north, a situation WHO described as cutting off a critical lifeline for civilians. Ongoing shelling, shortages of water and food, and a cratering of sanitation have compounded the crisis. By the close of this week, at least 70 Palestinians were reported killed in strikes that day, and local authorities warned that famine was imminent. The collapsing health infrastructure is also causing outbreaks of preventable diseases, including suspected waterborne and respiratory illnesses, although reliable data remains scarce amid the chaos. Elsewhere in the region, public health conditions were more stable but still demanding. The Gulf and Levant have been monitoring Middle East Respiratory Syndrome, MERS, since early 2025. WHO data, as of mid-May, showed recent hospital clusters of MERS in Saudi Arabia, underscoring the need for infection control in healthcare settings. Seasonal illnesses such as influenza and dengue remain on watch lists. For example, Dubai's health authority noted a rise in dengue cases in summer 2024. Vaccination campaigns continued, Lebanon pressed on with polio and measles immunizations, and Iraq prepared campaigns to counter the polio threats that emerged in 2022-24. No new major outbreaks, such as Ebola or novel coronavirus variants, were reported during this week, but health agencies cautioned that increased travel, for Hajj and tourism, could raise the risk of transmission of endemic diseases. The Hajj-related advisory in the UAE was in part aimed at preventing heat-related illness, which can cause spikes in morbidity among pilgrims each year. In northern Syria and Iraq, UN agencies worked to deliver vaccines and health services to displaced populations, while Jordan and other neighbors maintained emergency stockpiles. Climate issues also featured. A Middle Eastern heatwave in late May prompted regional advisories about sun exposure and hydration, mirroring the UAE's Hajj warnings, and raised concerns about heat stroke in vulnerable urban and rural communities. Overall, the region's public health challenges remain a mix of conflict-driven emergencies, like in Gaza and Yemen, and chronic burdens, non-communicable disease prevention, maternal health, etc., a dual focus that local and international actors alike must manage in concert. Let's now talk about wellness and health promotion. Wellness and prevention campaigns were prominent this week, especially in the Gulf. In the UAE, May is Mental Health Awareness Month, and officials noted growing openness to psychological well-being, especially among youth. A feature article on May 30 in Al-Ittihad reported UAE doctors observing that patients, including older adults, are increasingly seeking mental health support. The piece highlighted that global campaigns on mental well-being have resonated locally. Parallel to mental health, May 31 was World No Tobacco Day. UAE health authorities marked the occasion with a nationwide anti-smoking campaign. The Ministry of Health organized workshops on the dangers of tobacco and offered free nicotine addiction counseling and tests to help people quit. For example, MOHAP teams visited workplaces and universities to spread awareness of smoking risks. Public messaging stressed the link between tobacco use and cancers, heart disease, and even mental health impacts. These coordinated awareness drives reflect a regional push to reduce lifestyle-related diseases by changing behaviors. Other wellness initiatives in late May included fitness and nutrition programs by local health centers. In Kuwait and Qatar, private hospitals reported higher demand for weight management and diabetes prevention programs, consistent with national anti-obesity efforts. Bahrain's health authorities were planning summer fitness events to promote exercise, and Oman's Ministry of Health partnered with universities to encourage healthy eating among students. Though no single mega-campaign defined the week, the general trend across the Middle East is toward integrated prevention, combining tobacco control, mental health support, and promotion of diet and exercise. These efforts are often supported by multi-agency coalitions, for example government NGO partnerships on anti-smoking, and by leveraging May's global observances to reach public audiences. Always an exciting area to talk about is digital health innovation. Digital transformation in healthcare remained a high priority for Gulf states, although few new announcements specifically in this week's news. Government plans continue to favor telemedicine, electronic records, and data analytics. For example, UAE Emirates are expanding 24/7 teleconsultation services, such as Dubai's Doctor for Every Citizen program, and rolling out mobile health apps. The Department of Health, Abu Dhabi's remote care app, launched in 2024, allows patients to consult doctors by video or chat at home, reducing hospital visits. In Saudi Arabia, the Ministry of Health has been piloting AI-enabled screening tools and teleradiology services in remote clinics. Moreover, the WHO Foundation Tawuniya Memorandum of Understanding explicitly prioritizes digital transformation in healthcare and strengthening digital health systems as part of value-based care. At the industry level, the Arab Health 2025 Expo, earlier this year, showcased Middle Eastern startups in telehealth and AI diagnostics. Follow-up meetings in late May have been exploring partnerships, for example, between local hospitals and international health IT firms. Despite this momentum, more opportunities remain: interoperability of health data across Emirates countries, cybersecurity, and the need for healthcare worker training in new technologies. Policymakers continue drafting regulations for digital health, for instance, approving telemedicine practice guidelines and virtual pharmacy rules. The recent Hajj advisories also underscored the need to integrate health surveillance apps and digital health passports for pilgrims. While no specific new digital products were launched in this week, the trend is clear: governments in the Middle East are investing in e-health infrastructure and innovation incubators, with the goal of making telemedicine and health informatics ubiquitous parts of care by 2030. Hospitals were an integral part of this week's review. Hospitals across the region are undergoing quality upgrades and expansions. A standout development this week came from Qatar. Hamad Medical Corporation's Al-Wakra Hospital was officially recognized on May 27 as an age-friendly health system participant by the US-based Institute for Healthcare Improvement, IHI. This designation, the first of its kind in Qatar, means Al-Wakra has integrated a set of evidence-based practices to improve care for adults aged 60 and above. Officials noted that Al-Wakra, which also partners with Sidra Medicine, will now routinely focus on the special needs of older patients in all its departments, alongside Rumaila Hospital. The award reflects Qatar's emphasis on geriatric care and mirrors global trends in hospital accreditation for aging populations. Elsewhere, governments continue to invest in new facilities. Saudi Arabia is well into a multi-year hospital building program, with dozens of projects underway in Riyadh, the Eastern Province, and other regions, though specific openings were not reported this week. In the UAE, Emirates Health Services announced that it is outfitting several hospitals with smart OR dashboards and centralized command centers. Details were unveiled at a government media briefing, May 22. Kuwaiti and Bahraini health ministries are completing medium-term plans to refurbish general hospitals and increase bed capacity. Meanwhile, the private sector is also active. For example, the UAE's Burjeel Holdings, a network of private hospitals, confirmed plans to open specialized day surgery centers in Saudi Arabia in 2025, focusing on oncology and orthopedics, a project announced earlier this year. The common thread is that hospital operators in the Gulf and Levant are modernizing infrastructure with digital health and subspecialty care in mind. In conflict-affected areas, hospital news was difficult. Apart from the Gaza hospital closures mentioned earlier in our discussion, Yemen's damaged facilities remain under pressure. Health NGOs continued emergency surgery campaigns for war injuries, but whole regions have no functioning hospitals. Syria and Iraq are still rebuilding select hospitals destroyed in past years, aided by foreign donors, but progress is slow. In Lebanon, chronic strain on hospitals, due to economic crisis, continues, though private clinics are gradually reopening. Overall, the hospital sector in the Middle East is balancing expansion and innovation, digitally enhanced, patient-centered care, against the backdrop of regional challenges. Accreditation programs like Qatar's Age-Friendly initiative highlight the drive toward globally recognized standards. The ever-important population health management is next to discuss. Population health strategies, including insurance coverage expansion, chronic disease prevention, and data-driven planning, have been growing priorities in the region, although specific new programs announced this week were limited. Policymakers routinely emphasize universal health coverage and preventive care. For instance, Egypt is committed to rolling out a national health insurance scheme by 2030, a multi-year process first legislated in 2018, and discussions continued on refining that rollout. Gulf Cooperation Council countries are also exploring cross-border public health intelligence. For example, WHO and Gulf insurers have begun collaborating on joint surveillance of chronic diseases and pandemic threats, as indicated by a May 19 WHO Foundation Tawuniya announcement on population health management. On the ground, some efforts illustrate this trend. Saudi Arabia's Vision 2030 envisages a shift from hospital-based to community-based care, with new primary care networks, as seen in the Moja and other campaigns, and mandatory private health insurance for citizens. The UAE has been linking health records across Emirates for chronic disease registries and is studying value-based payment models. Kuwait's pension fund recently stepped in to underwrite preventive screening for its senior population. In Iraq and Jordan, donor-funded programs are digitizing patient records in refugee camps and creating population health dashboards, although these projects often proceed behind the headlines. Despite these long-term moves, experts caution that true population health management, with integrated data and risk stratification, is still earlier stage in the Middle East. This week's developments, for example designating Hemophilia Day, piloting community outreach in Lebanon, contribute data to the broader picture, but systemic implementation will require sustained investment. What is clear is a growing regional awareness that health systems must shift from reactive care to managing wellness and disease prevention at the population level. This is reflected in every country's current health plans, which now routinely include indicators for non-communicable disease reduction, immunization coverage, and digital health capacity. Let's conclude with this week's summary. In summary, May 29th to June 5th was a week of both progress and development in Middle Eastern health. On one hand, governments pressed ahead with high-level initiatives. Saudi Arabia mapped out a roadmap to tackle genetic diseases. With international collaboration, Lebanon expanded its primary care outreach, and Qatar achieved a new milestone in elder care. Public health messaging focused on prevention, from heat safety in Hajj pilgrims to anti-tobacco campaigns in the UAE. Digital health and hospital quality were steadily being upgraded, even if no single blockbuster drug or therapy announcement occurred during the week. At the same time, the region's deep opportunities and challenges were visible. The Gaza Strip's health system edged closer to collapse as war closed its last hospital. Ongoing conflict and humanitarian crises in Yemen and Syria continue to undermine health access for millions. Non-communicable diseases and mental health remain rising burdens amid lifestyle shifts, as noted by officials. Moving forward, Middle Eastern stakeholders, governments, private sector, and international partners will need to balance innovation with health crisis response. The trends of early June 2025 suggest a push towards integrated, preventive care and digital modernization, but persistent instability in Gaza means that acute public health threats must also be managed aggressively. For healthcare professionals and policymakers in the region, the week's news underscores the importance of adaptability, building resilient systems that can both embrace new technologies and withstand the region's recurrent shocks. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.